Today is Monday. Gosh, I didn't have a microphone to speak into. Hope you can hear me. The day is Monday, November 11th at 5:16, and this is the Pere City Board of Health meeting today. And we're in a different room today, so it looks a little bit different than what it has in the past. We're not in the council chambers. So in terms of attendance, people that are here, Devin Gerlach. Devin?
Here.
Here. Terry Villas.
Here.
Dennis Highbury is here, so we have a majority of Board of Health members. We're missing Pamela Gantz, and I don't know if Pamela is coming today or not.
Yes.
And we have a new board member as well, Robyn. Can you pronounce her last name?
Lauritsen.
Lauritsen. But she is not able to attend today as well. In terms of staff members, we have Crystal Waller.
Here.
Okay. Sarah Lauritsen.
You followed it.
There we go.
Did you switch rooms so I wouldn't show up?
I figured what the heck, it's what we did, switch rooms.
Hello. Hi.
Sandy did not say here. You are
Here.
okay.
I'm here.
Kelly Burke.
Here.
And we also have with us, I'm sorry, I have the name
Next to
down.
the
Huda
Yeah, I'm in.
Amin with the, as an intern here for the City of Pure Health Department. Worked on her master's degree in public health, so she'll be presenting later on this evening as well. So that you could join us as well. We're looking forward to your presentation.
Thank you.
So the call in order, we have no members of the public, so we don't have to deal with that issue. Approval of the August 12th minutes. Everybody's had a chance to review those. So can I have a motion for approval? Approval? A second? It's going to be very quick between all of us today, isn't it? Any discussion on these changes, additions, deletions, whatever?
Under title for my name, it should say board member,
Okay.
blank space.
That pre-fills in our program, so I have to look into that.
As long as Kelly has it.
Any other discussion items? Hearing none, all in favor of accepting the minutes as written with appropriate changes, say aye. Aye. Any opposed? The motion passes. We also have a special meeting that we have on October 5th. And it's covered a dog complaint in the city of Pere that was addressed by the Board of Health. We have meeting minutes from that, so can I have a motion to accept them? Actually, can I have a motion to look at the minutes?
I'll make a motion.
Motion, a second?
I'll second.
Second? Any discussion on this one in terms of content, how it was written, anything we're missing? Hearing none, all in favor, accepting the minutes as written, say aye. Aye. Any opposed? Nay? None opposed? Motion passes. Six. Board of Health resignation. It's sad to have people retire off the Board of Health, but it does happen. And we have ourselves Dr. McHenry, who after the last meeting decided to resign from the Board of Health after I don't know how many years he's been on. 8 years, so longtime person and a very valuable asset that we have on the Board of Health. And I believe that we have accepted his resignation already. Do we need a motion for that? He's not going to be coming back.
He won't be coming back.
No. I think it's just a FYI type thing, but we do have another individual that was appointed, Robyn Lauritsen. Who's not able to join us tonight, but she comes with us with a lot of good recommendations, a lot of experience working in the Green Bay and working with the pier and other things as well. So we look forward to having her at our, I guess that will be our next meeting, whenever that's going to be, which I don't recall right away. So I want to thank Dr. McHenry for serving for 8 years with the Board of Health. He was very valuable to have. He gave a lot of input. He will be missed. I hope he enjoys his vacation, his retirement and vacation and so on as well. So thank you very much, Dr. McHenry. Number 7, consideration and possible action on Wisconsin DHS Empower Agreement. Krista, would you like to address that a little bit?
Yes, I'll start, and if Sarah wants to add anything, Sarah is here, our preparedness coordinator and deputy health officer. Sarah had heard from the state that we have an opportunity to engage in an agreement with the state in the event of an emergency, that health departments and emergency managers can access a database that allows us to identify at-risk populations through Medicaid and Medicare data. And so this would help us respond to anyone who has potentially durable medical equipment needs or maybe some transportation issues. The trick with this agreement is that it's time-bound. It's for 30 days at a time. And so I can't have this agreement pre-filled out. I need to execute it when the event is happening for either pre-planning and or response. And so I just ask that in consideration, if you agree with moving forward, that in the motion, it would allow signatory authority to the health officer in this situation. Sarah, do you have anything to add? Perfectly. Any other questions?
Now, this would go take effect if we lose electricity in the city of Pere.
Yes, it could be any emergency.
Any
So
emergency.
it could be power outage, ice storm, of course, flooding, anything, any emergency.
And Empower would then provide you with a list of all the people that are on Medicare and Medicaid within the city of Pere, if indeed they have, as you say, electrical dependent devices.
Correct.
And what would happen at that time?
We could arrange for that vulnerable population, whether it's working with fire department to respond, to evacuate, prioritize their needs just because of their medical equipment that they have. We have been in discussion and haven't been able to solidify any sort of agreement, but thinking about maybe, relocating these individuals to a non-congregate shelter. So potentially a hotel, just so, they would be able to continue their, whether it's oxygen or whatever medical device that they have. Can you think of anything else there?
Sounds like a good program.
So could be really good to have.
Yeah. And like we said, for pre-planning and response.
Have we had situations in the past where we've had problems with them? I mean, if you're talking about power outage, how long does it have to last in order to affect? Is this something that's immediate, or is this something that you get immediate response back from the power so you know
Well, we could,
what's going on?
if she has that agreement, then we're able to access that data
Okay.
rather very quickly within, I want to say, within maybe 6 hours. They can get it to us very quickly. But for example, in April, that storm that happened, that was something that would have been when we had all the power outages going on around the county and neighboring counties. That would have been something that we could use.
And you feel like you've got the manpower to do that if there's we don't have any idea what numbers we're talking about, do we?
Right, it would be in close relationship with our fire chief and police. We wouldn't be able to go door to door helping just with our team of 5, but luckily we have a great emergency response team at the city. Really at this time, anything that we've done historically, and Sarah, correct me if I'm wrong, it's been very passive outreach. So it's like social media posting, there's a power outage. If you have needs, please contact, and we always list the fire department because they're 24/7. And that's what we did most recently.
Yeah, that risk communication.
Right. And so this will allow us just to connect with them directly instead of, in addition to, I should say, not instead of, in addition to social media, that passive outreach.
If
Especially
they can't have electricity, then they won't be able to access their social media.
Yeah, well, and that's what would be really helpful, because if it's a long-term power outage as well, it's something that would be very beneficial to the community.
Do you have any idea of the number of people in Decatur that are dependent on electrical?
I don't, not until we start pre-planning, so I have no idea.
And Crystal, you said that you can't get the information until an event happens.
For pre-planning, we can, but it's time stamped with 30 days. So once you execute it, it expires within 30
I
days.
see, okay.
And then all of those records have to be discarded and shredded.
That sounds like a,
Within 30 days, huh?
Right. And it is, right. I mean, that's a risk.
For their keeping that up to date, that database.
sounds like it's emergency response. Form a different type of emergency response, but it is emergency response for public health, and others are responsible for as well. So I think it's a good idea. Let's hope we never have to use it.
Right.
I guess that's going to be the issue. Any other discussion? Can we have a motion on this to accept the Empower Data Agreement?
I'll make a motion.
Second.
Second, any further discussion?
And then if we could just have that signatory authority delegated to the health officer, just in this specific one.
Can you adjust your motion
Yeah,
to that
yeah, come on.
to add signatory authority to the health officer or deputy health officer
Yes.
given any time the event occurs?
Yep.
Okay. Okay. Any other discussion? All in favor, say aye. Aye. Any opposed, nay? Motion passes. Okay. We have actually two considerations for possible action: affiliation agreements between Grand Canyon University and the Pere Health Department. That's number 9, and well as actually number 8, as well as one with Rasmussen College, which are identical type of considerations here as well. Can you talk a little bit about this, Crystal?
Yes, in that first one with Grand Canyon University, we must have a local person who is attending online and needs to complete their clinical rotation at a clinical site within community public health. And so they reached out to our department to see if we can accept this student. And so we haven't had an agreement with Grand Canyon University before, and this would be for a bachelor's prepared nurse. But they also, within the agreement, have other opportunities. So they have nurse practitioner. I think they have masters in public health. So they have many different healthcare degrees. So it would open the door for other students and not just undergraduate nursing students. So in this particular agreement, there is a specific student currently that is interested in starting in the spring semester. That would be spring semester, January. And so this is up for consideration.
They would not be on site, it'd be strictly,
They would be on
they would
site.
be on site. then,
Their
okay.
schooling is online.
I see, okay.
Yeah, I was hoping you were gonna say they would be here.
Yes.
Yes.
Is that also true with Rasmussen University as well?
Yeah, that one is a general. We don't have a student that's been identified to come on site, but yes, we would make sure that they would be on site as well doing their clinical time and a project typically. And that they have been reaching out to us, I think probably for the last 4 months.
Quite a few.
And really wanting to get an agreement in place. So That we don't have a student identified yet. And we do have to look at our capacity. We want to provide a good experience for these students. And so Sarah and I talk, and if we have the opportunity to identify a project and have the time to work with a student to give them a really good picture of what public health is in a governmental setting, then it has to be mutually beneficial. So we don't have a student identified for that second one.
But the agreements are identical, basically, are they not?
Yeah, Rasmussen, I'm not sure that they have a master's in public health program. That typically is for undergraduate nursing.
Okay, any discussion? Let's have a motion first of all. Can we combine these two into, since they're identical, basically identical type contracts?
Can we?
So we combine number 8 and number 9 consideration with Grand Canyon University, also consideration of Rasmussen University. You know, it must be our centralized location between the two. I think that must attract them to Pere. I don't know.
And I do think they have to be separate,
Do they have to be separate?
since they are separate line items for separate action items.
Yeah,
Okay.
yeah.
Then let's do it separately.
Thank you.
And I do have a question, but should I write?
Yeah, let's do a motion first to consider, I'm sorry,
Grand Canyon.
Grand Canyon first, that's what it is. And a second we can have for, let's have a second on that as well. Is there a second?
Oh, sorry.
Okay. Any discussion? Pam?
Okay, no, I forgot what it was. So they're not paid positions, correct? They're internships.
Right.
And the insurance for them is covered under the school?
Yes.
Okay, perfect. I thought that's what I read. I
Yeah.
wanted to make sure.
Thank you.
Okay,
Yeah.
thank you.
Any other questions, discussion regarding Rasmussen or Grand Canyon University? Hearing none, all in favor, say aye.
Aye.
Any opposed? Hearing none, the motion passes. Okay, let's go to Rasmussen University, which is located in Delaware. Same kind of situation. Same kind of benefits, which are really none at all provided by us except the technical expertise from staff. Let's have a motion if we need to discuss consideration of possible action by Rasmussen College and the Pere Health Department. Do I hear a
I'll
motion?
make a motion.
A second?
Second.
Okay. Any discussion on this one? Hearing no discussion, all in favor accepting Rasmussen University student as well? Okay. Any opposed? Motion passes. There we go. I hope you get a good student in Rasmussen as well, now, Crystal.
Mhm.
I hope you've got staff, Sarah, as well, to put them to work and have them assist up here quite a bit with that.
Yeah, we come up with lots of great projects.
Uda can attest to it.
Okay, item number 10, which is consideration of possible action on proposed 2025-26 health department fees.
Yes, so as part of the budget process, our finance and administration have asked all departments to increase any eligible non-statutorily regulated fees by 5%. The majority of our fees are agent fees as an agent of the state. So we did go ahead and impose that 5% increase. The weights and measures fees that are also attached here, we could not raise 5%. We can't take in more revenue than the program expends. So we have to be very careful with that. With the agent program, we're not exceeding our revenue with our expenses, so we were able to increase that 5%. So attached is the proposed fee schedule, and it's my understanding, and council members, you can correct me, that those will be going forward through finance and council in the coming months. I think it's after the budget gets approved, so. Oh. So, I'm just preparing, because I know we don't meet again until February, so I just wanted
Okay.
you all to see
Does this, I looked in here and I did see somewhere in here that it includes, the, food trucks, fees. And that's, I believe we were already at $200 an event per event, is that?
It's not per event.
Yeah.
So that's a license
Oh,
fee
license.
for the year.
Okay.
And then they go to events for free, but if they're inspected at the event, it costs them $48,
Okay.
$50 now.
that. And in addition, if they already have a license from another jurisdiction, we don't make them get licensed every year. So let's say they have a license, their food truck is licensed at Brown County.
Okay.
And they come in for one of our events, we would accept that if they show proof of that license in the last 12 months. And then we would just charge them the inspection,
And so there's not a fee for them other than, okay.
other than the inspection.
Okay.
Do they get that inspection every time, or is it just random, or
It's random.
they get low, just inspect them?
It's based on just its capacity and what she has going on. And a lot of times she won't go, like, let's say farmer's market. She won't go to every farmer's market, but she will spot check and ask for a list of vendors. So,
Well, if she's anything like the building inspector, she inspects pretty frequently.
oh, she does a good job.
Okay, and you said the reason why we can increase the fees for the hotel and restaurant program is because we are not, we spend more than what we bring in. So we can do so at this time.
Yeah.
Okay. And for weights and measures, we do not, so that's why that cannot be.
Correct. That's right.
Okay. Can we have a motion to discuss the consideration and possible action on proposed department license fees?
I'll move to.
Motion, a second,
Okay.
second. Okay, any additional discussion on this? No discussion? Okay, then all in favor of accepting the 5% increase in hotel and restaurant license fees? I'm saying that in general manner, that includes everything else associated with the Department of Trade and Consumer Protection. Say aye.
Aye.
Opposed? Hearing none, the motion passes. 5% increase it will be. I'm going to ask you very quickly, Crystal, I should have brought this up before. Do the operators know about this 5%?
They do not at this point. The next billing cycle will be, we send them out in June. Is that right?
The renewal notices go out usually in May,
May?
because they're due at the end of June, so usually sometime in May.
So it's kind of tricky because the fees are on a calendar year with the city, but then, the license
The
year.
license fees start July
So no, we
1st
don't.
and go, yeah, it's kind of a messed up system that way, but it's been that way for years, so. Not messed up, just a different system, different
Different
time
cadence,
frame, I
yeah.
guess. is what it would be.
Is there a refund on?
And it works with the state operating budget. The state budget starts July 1st of the year, so all the fees and things associated with the state begin July 1st. Well, most municipalities, in fact, all municipalities and cities and counties always begin January 1st. So if there's going to be a fee increase, it's going to be July 1st when the fees go up by the municipalities, because that's the time that their license expires, June 30th, and then it becomes effective again July 1st by state statute. So that's the reason why. But they haven't been able to coincide this at all. They haven't changed the calendar year. It's always been it's been state fiscal year is what it's been. So, and I don't see it's been that way for years and years. And so it's going to not change. I don't think we don't have any authority to change that.
It's not like you can face it.
Yeah. Makes a headache for the local agencies when that happens, but they're used to it, I guess, now. It appears used to it. It's been that way for years, so Okay, number 11, program performance management dashboard update.
Yes, so this is our second quarter that we've been reporting out in this way. It was introduced to you all back in August. This was Zach's, he was our master's student who was from Colorado, but was a Calumet County health officer. It was his project,
Okay.
something that he worked with the staff team, myself, to get this published. So I just want to highlight two things. It's been very interesting to have these program performance measures. And number one, you all maybe recall that you approved the EPIC access for HS, and Aurora, those agreements. And you will see under communicable disease, our response time has improved at least 60 to 70% from staging, from the time we receive that communicable disease report to the time we assign it, because we have more information at our fingertips to be able to investigate and finalize these communicable disease reports. So it's really neat to see the measures improve based on some sort of inject, like the agreements that we have executed with your approval. So it's been neat to see. The second thing I'll call your attention to is under the environmental public health section, where one of the indicators is staff capacity to meet inspection standards by FTE status. Now, Trista is a 0.8 FTE for establishments under the food, under agent program. And it cites that in that standard, we can, at that FTE, inspect up to 256, or conduct 256 inspections. And we have definitely hit that. We are at 100%. And we also know that she was feeling that. So the numbers are showing it. She was feeling that pressure. We've made some changes operationally, offloading like animal bite report follow-up to Sarah. Sarah's taking the lead now, doing that. So it takes that off of Trista's plate. Also, we have that environmental health intern, remember Austin? So he conducted about 33 inspections of those. So that, if I included that, that would bring us back away from that 100%. Because I think it was a bit over without that. So just seeing that capacity allows us to kind of make some operational changes with how we're conducting business. So that has been interesting to see, and we're still building it out. It's all about consistency. We're still trying to figure out the measures and how we're reporting it, and running the reports that we need out of health space, and different things. So it's a work in progress, but it's showing beneficial so far. So we've been really excited about it. And this is one of the components of an accredited health department. And we're always moving towards best practices. And so I think this is on that path. So.
How do you document success in this? How do you document what you're, in the impact you're having as it relates to quarter one, quarter two, three, and so on?
Yeah, I think that right now we're just developing the baseline. You know, what does it look like for our health department? And once we have that, like let's say under like our outreach attempts, maybe we did 100 this year, but next year it'll allow us to strive for more, right? If we have the staff capacity to do so. So I think it's just developing that baseline and just then looking for, oh, we didn't need that. Like one example I think is going to happen, this is my projection, I don't think we're gonna quite hit our influenza vaccination projection that we have, and that's, we used last year's numbers. And so then as a staff team, we can sit down together and be like, okay, we didn't hit it. What can we do differently? Do we need to outreach more to, the schools? Do we need to go to the daycare centers? Do we need to, so it just allows us to do some quality improvement. And I think that's success in itself, always striving for improvement. And I know you all like the detail of what we used to have under the spreadsheet, so you'll see that our outreach opportunities that we did list in there in the last quarter.
And your staff feel comfortable in filling out the reports and stuff like that, the information that's necessary to put this together on a quarterly basis?
It is a work in progress. It is. We're using our Outlook calendar in a different way, so we're not developing extra spreadsheets or different things. Like, we're trying to make it part of our everyday operations. So when we put some sort of outreach event in our calendar, we figured out a way where we can run a report so that we can just copy and paste it into this document for you all. So we're trying to normalize it so it's not extra work. I don't know if staff have any comments on it.
No, but I also think it's a great tool because it's showing the great work that all the staff is doing. They're seeing that. I know it's really been great going, oh, yeah, look at it. We are meeting those goals.
Yeah.
Or where do we need to reassess and work at?
I heard great things back from the join or die screening, so.
Yeah.
There.
Yeah, I was gonna ask you about that.
Yeah, that was a great
A lot
idea.
of great feedback.
Good. And there was, I see Rock the Block is on here too.
Mm-hmm. Yeah, and that was fun. I mean, we learned even with that engagement opportunity, riding along with our fire department and visiting all the residents, like, what can we do differently to get public health out there? And maybe it's handing out popsicles and talking with the kids. I mean, whatever it is, it's like, hey, what can we do differently to?
Well, it's a camper that attracted everybody.
It was the camper, it was the for sure. And our smiling faces, yes. I think popsicles.
I'm glad to see you went to the Pride Alive too. That's very good.
Yep, Danielle was able to go to that, so that was good.
And the Be the Light walk.
Yeah, I was gonna ask how did that go?
Yeah, Danielle was there as well, Be the Light, she did registration. And just the numbers it's always an impactful evening.
I always
Yeah.
Nice.
Any other discussion regarding this item? We don't need to make a motion on this. I believe this is kind of FYI for us, is it not? Okay. Thank you very much for the clarification on that, Crystal and Sarah. Communicable disease, Q3 report.
Yes, Danielle prepared this nice summary. So you will see here, we have completed a latent TB infection direct observed therapy. That case has been closed out. In this last quarter, we did have a case, breaking. We did have a case of West Nile, but it was determined that it was not a case after all. Today, it went to the CDC and additional testing, and Sarah found out today that it actually wasn't a case, but it was logged in our WIDS electronic disease reporting system as a case until today. We had 9 cases of pertussis. This next quarter, you will see more. But 9 cases. Again, pertussis is circulating in our community all over Wisconsin and the United States. We're up exponentially. So we're not outside of the norm for, that circulating across the state.
Is that related to fewer people getting vaccinated?
I think it's combined. I think it's that. And I also think that the vaccination is waning as you get closer to that booster recommendation. So I think it's twofold. And we're just seeing that.
How do you get the information? Like, how do you know who's had COVID? Is that drawn from like Epic and
Oh, who's had COVID or
Right.
pertussis?
Either, any of these
Oh.
things on here.
So pertussis is a reportable condition in the state of Wisconsin, so, as well as any outbreaks. So
Okay.
the positive cases we get reported from the labs,
Okay,
and then school nurses,
Okay.
schools will call us with any suspect cases that are going in for testing. So it's just that communication between providers, labs, schools that we get notified.
and then COVID.
Yeah.
Same thing.
Yep, COVID is
Okay.
still being reported, hospitalizations and follow-up, accordingly.
Yeah,
Yeah.
it's no longer a category 1, it's a category 2, so really just the hospitalized cases that we do any.
Okay, so if it's not somebody that's been in a hospital with COVID, then that wouldn't be included in that?
No,
Okay.
it doesn't get reported.
There's so many home tests now, there are many cases we
That's
don't
true.
even know about.
I think the most accurate is probably wastewater, looking at those reports.
Interesting.
Are we still seeing increases in COVID in water reports, or has it stayed relatively stable?
It actually declined. We get those reports weekly. And so now we're in the low category. There was a time where we were up higher towards the end of summer.
Well, it's nice when something's declining.
Yes, that's right.
Any other questions regarding the communicable disease report? Hearing none, environmental health, Q3 update.
Yeah, this was submitted by Trista, so thank you, Trista, for putting the summary together. Trista's been working very hard on those program standards. It's almost like accreditation, self-assessment for the environmental health program. And so she is almost done, and I'm sure she'll report in the next quarter that she has completed that. She also has been working hard getting all the weights and measures inspections completed, especially the gas stations, because she doesn't want to be out there in the dead of winter hauling that fuel around. She calls it slinging fuel. And so she's been working hard on that. And then, of course, I can't not mention the tourist rooming house. Developmental services and our department have been working together to get those processed, and we're up, I think we're up 35 new establishments or new tourist rooming house licenses
Because of the draft, coming draft. Okay.
Yeah.
Well,
So it
a
keeps-
$2,500 penalty for not doing it.
Right.
I guess that would get your attention, wouldn't it? Also. Okay. Is there any future ideas about getting another student here to help Trista during the summertime?
That is the goal. That's the plan.
Okay.
I said the other day to Trista, Austin set a pretty high bar. So we hope that we can get another proactive, professional student. And we had a lot of interest this last go around. It was the first time we've ever done it. And so it was a competitive process. So we're looking forward to it. And she does need that assistance in the summer.
But I think so too. I think it's nice to have that. Plus, I don't know I know in Eau Claire, I don't even know whether Eau Claire has a program like that anymore now, but it was a requirement to have that between your junior and your senior year.
Oh.
Have a 10-week internship. That goes back a number of years, but I don't know if other universities require that or not. So
Yeah, sure. I don't think we had a student from Eau Claire apply this month, but it's a good opportunity to outreach to that institution. See.
okay. And director's report, Crystal.
Yes. So my report here, you'll see the bullets, just really circling back with you all about the community engagement events. We were very busy in September, giving all that detail in the first couple of bullets there. We did try a new outreach method through social media, some paid advertising. Some of our grant money allowed us to do that. And so we also had some coverage with the Press Times, which was nice to see. We started our vaccine clinics in this last quarter, and we have for the first time our MCW MPH student, Huda, joining us. You'll hear from her in a little bit. And then finally, and I really wanted to highlight this too, Sarah and I met with the regional director, Chris Kulata, on the opportunity to pursue a designation of a level 3 health department. Really, as Sarah and I looked at all of the qualifications, us moving up to a level 3 health department, which is the highest level in the state. We're a level 2 right now. We just had our chapter 140 review. I think most of you participated in that. It's not going to generate any additional operational expenses to do this. It's actually going to bring in a little bit of additional revenue because it's a funding formula through the state of Wisconsin for consolidated contracts. So it's not anything to write home about, but it's something. And so we're very interested in moving forward and exploring this opportunity. Again, always trying to improve, what we're doing, even if we have to go through the process of evaluation and documentation. I just think if we're doing it already, let's formalize it and get that designation. So that you all know, and if anyone had questions about it, to be able to talk through that.
That's wonderful.
Yeah.
Great.
And
The only issue that you have with level 3, we have a small health department being the number of staff, and you have a large number of programs you have to achieve with level 3 and achieve them not
Just one.
on paper, but actually physically as well. And that's where the rubber meets the road at, I guess. So it'd be an accomplishment, but I think a relatively tough accomplishment with the number of staff you have here, which I think we are going to see an increase.
No.
And so
But you said you're already doing these things.
Yeah, I mean, looking through the qualifications, the biggest difference, the health director needs to have a master's degree, which I have, and the programs that are being delivered, it talks a lot about they revised the 140 code, I think it was in 2018. It was after I left. But it has a lot to do with performance management, quality improvement, the dashboard that we have instituted, the performance management plan. And then, like Dennis said, you'll be hearing more about health and all policies and different things and initiatives that we're moving towards. It's something that we really would like to explore and talk through with the state. And I know that Chris, and I can't remember the woman's name at the state that was with him, Sharon from Madison, met with us initially, and they didn't see any concerns that they communicated from what they see just at first glance, but knowing that we would have to go through a rigorous review.
yes.
And they did say that because we just went through the review in November of 2023, just before I got here, that we wouldn't have to do that part again, that we could just dive into that differentiating level 3 component and then review those things. And then it resets our clock for 5 years. Which it's worth a try.
It's worth a look at, yes. I agree.
Yeah.
And things probably have changed since I left the state as well. It used to be programmatic type
Sure.
things, a number of programs.
Yeah.
And really proving that these programs are being done. I don't know if they've changed. He's mentioned 2018. I don't know how much has changed or what's changed too, but I know it was very difficult for a small agency to maintain level 3 status.
Right.
And there wasn't that much difference in what you received from level 3. I mean, there is, I think, but is it worth it, I guess, with the headache that's associated with it?
Sure.
So walk on with
I appreciate that.
soft feet, I guess, that I can say with that one, because it's because once you're level 3, you have to maintain it as well.
Right.
That's a whole different ballgame, is maintaining it. So
Right. Yes, and you will all be invited if and when we get to that point to participate, just like you all were invited with the level 2 designation in November of 23. But I just wanted to be transparent with that, to say that we're exploring the feasibility.
There's nothing wrong with doing that whatsoever. Just look at it with real eyes,
I appreciate
with
that.
open eyes, I guess, on that one.
Yes.
Okay, thank you very much, Crystal, for the director's report.
Yep.
We have with us Huda, who's going to be talking, I think I pronounced it right, from Sudan. We just met beforehand and talk to us about health and all policy introduction. So I don't know what this is, but we're anxious to have you tell us about it, Huda. So
Just one second. We will get the PowerPoint up here and share it because I do know, is V still on? Yes, V is on. She is a state Office of Policy and Practice Alignment staff person, and she has been guiding us in health and all policy initiatives. So,
Crystal, before we start, can you tell us a little bit about Huda, how long she's been here,
Yeah.
and what is she busy doing, and
Sure.
background and so on?
sure. Yes, so Huda, again, is from the Medical College of Wisconsin. She's in the Masters of Public Health program. She has been with us since, I would say, fall semester. I'll say fall semester. This is, and Huda, I can turn it over to you too. This is your public health clinical rotation. And there is an opportunity also for a capstone project as part of her program. And so we've been meeting together, Sarah, Huda, and myself every week. And we've been talking through this initiative called Health and All Policies.
So it's supposed to show here. But it's not. That's our main screen, isn't it? No, that's not what.
Well, B, she is the only public person on, oh, and you clicked window
Yep.
and it's not showing up.
popping up.
Okay.
But it's here.
It's there. Okay, so V, I know you are on and you have a copy of this as well. So V can listen and then engage in conversation too. But V, are you okay with that? That you're not seeing it on your side? Unless she stepped away. I know she was muted. So we'll just go ahead.
Okay.
I don't know without IT here how to fix that. But we'll go ahead with the presentation.
So your first slide, and I can probably give you the mouse.
If you want to put it in presentation view. Right here.
That little icon. It's a touchy mouse.
I know, be careful. There you go. Okay.
All right, so I'll give you, and mind my accent, you have to focus because I have a bit of accent. So I'll give a brief introduction about health and all policies.
Okay.
So
We might have to.
Oh, you want the
Yeah, just go
keyboard?
ahead and there you go.
So what is health and all policies? Health and all policy is a framework, and it's a collaborative approach to improving population health. It's done by incorporating health consideration into decision making across sectors and policy making areas. This framework engages diverse governmental partners, stakeholders to work together to promote health, inclusivity, and sustainability. So the framework, the health and all policies work through three strategies: policy change, system change, and environmental change. So example for these strategies, let's say the city wanted to remove unhealthy food and beverages from vending machines on the city property. So the policy change will be rewriting and negotiating vending machines contract to include only healthy snacks and beverages. The system change will be asking the distributor to only stock less unhealthy snacks and beverages, and the environmental change will be removing the majority of unhealthy snacks. And also it can be like the product placement can place putting the healthy snack at high level so people will choose it first. So why do we need health and all policies? So it's now widely accepted that the environments that people live, work, and play can affect the health, the population health significantly, and it can impact the health outcome across population. So health and all policy approach is to ensure that policies made outside of the public health sector have positive or neutral impacts on health. Promoting healthy communities requires addressing the social determinants of health. You might have heard of this thing, but I'm going to talk about it in the next slide. And this approach requires innovative solutions, a new policy paradigm, and structures that break down the siloed nature of the government to advance collaboration. And whose job to do that? It's not only the health department, but all the others that involved in policy work within the government have a role in this. So what are social determinants of health? So it's essential to recognize that the healthy communities and health of individual is not just influenced by access to health or individual behaviors. It's also affected or influenced by many factors surrounding the population, such as these factors. It's not non-medical factors, can influence health outcomes. They're all known as social determinants of health. It's the condition and the environment in which people live, work, play, and grow and age. And it's a broader set of forces and systems shaping the condition of daily life. These forces include system change, economic policies, development agenda, social norms, social policies, and political system. And we need all these social determinants of health to be in place and to be, we have good social determinants of health so we can have healthy life, or we have good health. Here it comes the policy rule, improving the environment. So the policy improve health environment through the policies provide framework for achieving healthy environment. Policies can affect everything, including access to healthy food, access to clean water, clean air, physical activities, housing, jobs, and schools, and these all are the social determinants of health. So you'll be healthy when you have all these healthy environment around you. It's not only genetics or access to healthcare. Health and all policies will work. So historically, the most successful achievements in improving community health have been implemented through health and all policies. For example, seatbelt laws have saved over 250,000 since 1975, and laws that prohibit smoking in public places and laws that raise the prices of tobacco products have helped save more than 1.6 million lives since 1964. However, we have also made many policies without ever considering health. Here in the city of department, they have local successes of this framework, health and all policies, all in practice. Like for example, they added youth membership to city governmental committees, which increase access to historically underrepresented groups such as young people in enhancing the city's capacity to develop policy that reflect the needs of all the community members. They have another project, the urban orchard, which supports inclusive access to food through edible landscape and incorporated science curriculum. They have the naloxone Narcan boxes. This supports harm reduction in the community, and the permanent drug drop boxes. This prevents the misuse and abuse of prescription drugs and also prevent contamination of water supplies. And they have the noise ordinance review in the vision. We all know that high noise may be considered a public hazard and has ability to cause negative impact on health of the population. So the city of De Pere have been also already implementing some of these health and all policies approach. So how to formalize this health and all policy? Local governments have committed to adopting this approach decision to implement the health and all policies framework. The formalization, it comes in 3 forms. They may adopt health and all policy language in comprehensive plan, like having public health section in the plan. Some of them have adopted the resolution committed to this framework, and some of them have passed ordinances. The role of public health in this framework is to educate and develop ongoing channels for cross-environmental collaboration, cross-departmental, and create tools to assist others to consider health in their policies, and to explore opportunities to continue good policy system, environmental changes, and in improving health, to assess political will to implement formal health in all policies, resolution/ordinance. So this presentation is intended to be like the primer for more to come. You will be hearing from the health department as it relates to health in all policies, as they explore potential projects within the department, within the city, with other departments in the city. Thank you. And if you have any question, me and Chris answers.
How difficult is it to get health policies implemented in normal day-to-day type activities? Things that would have an impact, I guess. I guess I'm trying to think is it difficult to get public health incorporated in policies?
No, it's not. Because it's already doing that. Public health is incorporated in everything. But to consider it as a framework and to formalize it, you need to have this wording, and you need to have it formal, so people will commit to it. But it's already going on. The public health is already having those projects going on, like the orchard project, the Narcan, and the drop boxes. So this is all considered, but this is public health department work. So we need other departments to consider incorporating health in their policies. Like when, for example, if you're doing let's say the park department, park recreation departments, if they want to build a park, or let's say the other example is the roads. If they're building new roads and you're extending the roads, the highways, when you extend it closer to the neighborhoods, you have to consider the combustion and the stuff that can affect the health of population, like the people with asthma can be affected by the extension of these roads. So this is the thing for health and all policy. Need to consider the health of population in their policies.
So I guess I'm thinking, you have to get buy-in by all these other agencies as well.
Mhm.
Is that difficult to do?
Well, lots of cities have been doing it. Lots of local government doing it. For example, here in Wisconsin, Appleton has implemented an ordinance, city of Appleton. I have an example from California, from the East Coast, and it's been going on since like 2010. It's not a new thing, but everybody's starting considering passing all policy.
I think we're set up in a nice spot because we're small, and I think collaboration takes time and effort, but it's easier, not easy, but I would say easier when we can walk down the hallway and say, "Hey, chief, you know, why don't we get some drug drop boxes?" Or Dan with developmental services, "Hey, have you ever considered maybe, you know, who knows, doing an incentive program to bring in certain businesses?" And so that's something, as Huda mentioned, we've done a lot of great work already, and I think it's our opportunity to build on that work. And even if we're not at the table, maybe it's to create tools to assist others to consider this if we're not at the table. Because like Dennis said, we have a team of 5. And we can't be everywhere all the time, but maybe we could provide tools, you know, a decision tree, like, have you considered X, Y, Z in this policy, to make sure that we can apply health in all policies. So I think, as Huda mentioned, this is an intro, this is a primer to a concept that we want to, again, explore further. And we look forward to meeting with other department heads to see, you know, what projects they have, what policies they have, and then also ask and try to develop a tool to be able to have others consider health in their policies.
I love the idea of looking at the different divisions that we have, and like incorporating health planning into the policy, planning and zoning stuff like you were talking about with roads, or like, you know, like I always think about the coal piles and but different things like that. It's not called the dump, but it is the dump. It's like, you know, if that were ever relocated, what is the impact of that on the people that live near it?
Right.
So yeah, that's really cool.
I think any input you can make to make sure public health is at the table, or at least public health is being also considered, because most people have the narrow focus, saying this is what my job is and this is what we have to do and how do we get from point A to point B, without looking at other things associated with, you know, whether it's health or whether it's the environment, or you know, who knows what it could be, you know, but trying to make sure that public health is also being considered. The impact, I guess, of what this project can have on public health, on the health of the people in the area,
or on the people that are doing the work, like the public works department and stuff like that. You know, are the employees, do you track the people that have the back injuries or things like that, and but looking at how you can prevent, you know, back problems. Yeah.
Right. Yeah, so more to come, either in my director's quarterly report, to just explain any progress that we have, whether it be tools, and, you know, maybe it would be a policy coming forward to the Board of Health to recommend on to another committee or city council. But we're exploring those partnerships and what we can build upon. As Huda said, there's a framework, there is also a foundation that has been set, and I don't even think we even realized it was health in all policies, you know, when we were implementing urban orchards within the city, or the other examples that Huda described. So more to come, and Huda, great job. Great job.
Thank you very much. But the only recommendation I had, I would change the font. Make it bigger, bold, or something.
You're just far away. Sign right here.
Oh,
I'm ready to move up there.
That's a good suggestion. Thank you.
I always like to make it as bold as possible and big as possible you can get so people can see it from anywhere in the room instead of where Kelly's at.
That's why I sat here.
Thank you for that. Appreciate that. Thank you.
Yeah, thank you. Very interesting.
Okay, number 16, future agenda items. Activities on that. It is. I'll be going to WADA with Crystal this Thursday.
Nice.
And the state health officer, I think, is going to be there, right? So I've never met her before. She's new, probably several hours since I was there. So
There was
I'm interested in seeing that and seeing the other health officers that have retired and seeing the new ones and seeing about that. So
There was a WALDAG, they were doing the webinars. And I don't know, I haven't seen one since the one, was it September, I think, where they talk about refugee health, and it was like linked to something by the Public Health Association, Wisconsin Public Health Association, but it was a really, really good thing on refugees. And I don't know if that's, if they're gonna continue doing the webinars. I loved them, I thought they were great.
Yeah, I know that they do plan to continue that education through the organization. I just don't know the cadence
Okay,
of the opportunity, but I do know that they do plan
okay.
to
that's
continue
good.
those.
And then when they talk about the refugees, I don't know what in Pere, if we're doing anything with the refugee health.
Not at this time. I know Catholic Charities, I know Brown County gets very
Okay.
involved outside of the city of De Pere. Unless they have settled within our city limits, then we assist
Okay.
with some components and immunizations,
Yeah,
of course. And
Sure.
things like that.
Vaccination clinics.
But Catholic Charities takes a strong lead in
Okay.
that.
Thank you.
Yeah.
any other discussion on future agenda items? Hearing none, I guess the next thing is adjournment.
I move.
Move, second for adjournment. Any discussion? All in favor, say aye.
Aye.
Opposed? Meeting is adjourned. Thank you very much.
Yeah.